So welcome back. We're here with Dr. Diarmuid McCoy, Specialist Pain Medicine Physician. And in this video tutorial, we're going to talk about the role of infusions, because case managers are often requested to provide an infusion of some kind or the other. So Dr. McCoy, can you talk to us about infusions and what their role is in pain management?
So frequently when patients present to a specialist pain medicine physician, one of the options is to try to globally decrease their pain by using an agent which will do such a thing both for nociceptive pain and neuropathic pain. And one of the drugs that we use is a very old-fashioned drug called ketamine. Ketamine is a phencyclidine drug, which is chemically related to lysergic acid diethylamide, otherwise known as LSD. Ketamine affects a particular receptor called the NMDA or N-methyl D-aspartate receptor. And this is a ubiquitous, widely found around the body and has many effects. It is found in the cardiac system, the respiratory system, the central nervous system, and of course in the pain transmission system, the sensory nervous system. We use it in an effort to decrease the pain globally for the patient. Essentially, I tell the patients it's to hose down their pain and see can we bring it down to a lower level. It is a very effective drug. It's a very safe drug. It doesn't have the same side effects as opioids of respiratory depression and those critical side effects which would cause morbidity and probably mortality. It is not, however, without its problems. There are side effects such as hallucinations, and this is something that we have to warn our patients about. And though I warn all patients about it, it is an unusual phenomenon to experience in the doses that I expose them to. It doesn't really matter whether it is delivered subcutaneously, in other words, under the skin, or intravenously. We generally use it subcutaneously as it gives the patient more freedom and provides fewer risks in terms of infection. We generally run them over between 5 and 7 days, sometimes a little bit longer. The effect of it is to decrease their pain. That is why I am primarily requesting a ketamine infusion, to globally decrease their pain. If that allows a secondary benefit, such as improvement in function, improvement in quality of life and mobility, and a decrease in their opioids, that is an added bonus. But it is not primarily used to decrease or detoxify the patient from a drug of one type or another. We generally keep them in hospital for between 5 and 7 days, and during that time we take the opportunity to get to know the patient a bit better and for our allied health colleagues in occupational therapy, physiotherapy, and possibly psychology to get to know the patient and provide some strategies for the management of their pain. It may be a long-term solution. They may get many, many weeks or possibly months of analgesia from a single infusion, but it may need to be repeated. Just like any medication or a pain management program or a session of psychology will probably need to be repeated in order to maintain the pain relief and the pain management strategies that the patient has. Another infusion that we use a little less frequently is lignocaine. Lignocaine is a local anesthetic, the one that you get from the dentist or when you're having a mold taken off or stitches. But intravenously, it was useful for calming down abnormal rhythms of the heart in years gone by, called ventricular tachycardia. But nowadays we can use it for specific pure neuropathic pain states. The research on this is less robust than for ketamine. However, there is a place for lignocaine. It has an evidence base. It is less than some of the other medications, but it is robust. It's used in a similar way, subcutaneously, over 5 to 7 days, sometimes in concert with ketamine sometimes on its own. For pain states that it might be useful for in are neuropathic pain, for example, diabetic neuropathy, or a radicular pain after injury, headache, and some other pure neuropathic states. An example of this would be post-herpetic neuralgia or shingles pain. So they're the two main lignocaine and ketamine infusions that we use for the management of pain. They have to be done in hospital and they have to be supervised carefully, and a specialist pain medicine physician is probably best placed to supervise such patients.
So it seems to me that infusions have a very important part to play in people experiencing severe pain, but obviously it's a double-edged sword because they are inpatients and admitted for quite some period of time. To what degree are either of these infusions used in pain management?
Well, in a specialist pain management provider, they might be used a little bit more than in other services, but ketamine has been used in acute pain and indeed in cancer pain, but we use it for a minority of patients. And you'll hear me saying that we use such and such for a minority of patients because that is where it sits. We don't use opioids in all patients. We don't use anti-inflammatories in all patients. We don't have all patients see a psychologist or indeed a physiotherapist. But some patients will need a combination of these, and that combination changes through their pain journey. They may need a ketamine infusion early, middle, or late through their pain journey, or they may not need it at all. Similarly for any of the other modalities.
So we've done so far, Diarmuid, we've done 13 video tutorials on the matter of pain, and it's clearly very complex and clearly requires a very high and specific level of expertise in managing an individual's pain. I can absolutely see why specialist pain medicine physicians have their role in providing expert advice around pain. So thank you so much for sharing your insight with us. There's one final topic that we want to have a discussion about, and that is the role of surgery, manipulations, and other kinds of injections, particularly when they pertain to things like joints and discs and nerves. So in our last webinar with Dr. McCoy, we're going to be looking at, where do we go with back pain, what's available, what's effective, and when and where to use. So again, I hope you join us. Thank you.
Thank you.